This is Dr. Reken at Reno Sparks MedSpa, and Maxine has kindly consented to let us video her skin tag removal. She has a couple of different things on her neck. Why do you want them removed, Maxine?
Just to improve my appearance.
All right, always a nice thing to do. So she has a couple of different things. She's got a couple little red ones. Those are cherryangiomas. We're not going to mess with those today. They're easily treated with laser. And then if you look at some of these little things that move and they're on a base, these are skin tags. They'll come off very nicely with the curved iris scissors. And then she has some other things that are flatter, raised a little bit, and I can maybe trim these down a little bit with the scissors, but it won't really, it's not the perfect tool to take this all the way off. So I'm going to focus on these things that stick up, and they do show up more, particularly people with a little darker eyes or darker skin. They tend to be pigmented, and if you look at hers, there's a little bit of brown there. So they're more obvious because they're brown. So what we're going to do is we're going to take a curved iris scissors, and I explain it like this. If this is something sticking up from the skin, and you take a flat scissors and you cut it, you might get some of my finger there. And you might get too much skin and sort of a slit in the skin and a wound that you didn't really intend to have. But if you get a curved scissors, you kind of stick right over that tag, and it's cosmetically nicer because you don't get that extra skin. You'll see it when I'm doing it, but it's a superior way to do it. And it's inexpensive. All right, so we have already cleaned her. We have already numbed this area up with some topical lidocaine and so forth. So this is going to look like it hurts a little bit, but it really won't hurt her much because she's already been numbed. All right, we'll get started in just a minute. Thank you. These are the curved iris scissors I was talking about. You can see the curve in them, and so that when you open them and you get something, you get just what's sticking up and you don't get too much skin. Does this hurt, Maxine?
No, it just stings a little bit, like a bee sting.
Uh-huh.
But nothing major.
And you can see how nice these are coming off. A lot of them, you may get a little bit of bleeding, but not too much. She'll look quite a bit better even in 3-4 days, and much better in a week. If all of these are small tags, which they appear to be, she'll be pretty well healed in a week. But it's not like she can't go to work tomorrow. You've been looking at those things for a long time, haven't you?
Yes.
Well, sorry to deprive you of your viewing experience, but they're gone. So some of these can be taken off with different techniques, including laser. These are flatter lesions, but the ones we snip generally stay gone. So this is Dr. Reken at Reno Sparks MedSpa. Make sure that if you're having skin tags or any other skin lesions removed, that the person doing it has some experience looking and can tell things like cancer from skin tags and other benign things. These are all clearly benign, so I'm not worried about it. But this is an easy procedure. I recommend the curved iris scissors. I was taught a different way. I actually learned this from a book about 10 years ago, and I decided to try it, and once I did, I realized it was a superior technique, so that's what I've been doing ever since. So thanks to Maxine for helping us out today, and you look better.
Thank you.
All right, see you later.